you know somebody who needs your support. And sometimes patients are discharged from hospital when they are still sick, and a doctor can refer these people to home health care. A doctor may also order some home care for someone with a disability or living with a chronic illness. Now, the home care team monitors the patients, helps them care for themselves so they can heal safely at home, or help them to reach a level of independence amidst disability. According to the World Health Organization, we learned that disability has 3 dimensions. There's impairment, there's activity limitation, and there's participation restrictions. And that will be defined better by our guests in studio. My name is Caregiver. If you're watching on Facebook, what you need to do is share this video. Everybody needs to know and watch it. Thank you so much for joining me, our guests. One of them you know very well, Mr. Duncan Chengo, Occupational Therapist. Thank you for joining us again.
Thank you.
How timely is this topic?
It's long
Overdue.
time overdue.
All the time we meet, we want to go deeper into this, but we never get to do it. And so today we will.
Yes.
Where can guys check you out and what you do?
I'm an occupational therapist,
Yes, sir.
by profession.
Yes.
Ideally, my duty is to help patients, and to be specific, patients who either they are likely to slide into disability, or the ones who are already experiencing disability. So my role or my duty is to enable them live an independent life through promoting what we call activities of daily living. We technically give activities of daily living into 2. We have what we call instrumental activities of daily living, and we have what we call basic activities of daily living. Basic activities of living puts all human beings at one level. For example, all human beings go to toilet. All human beings feed. All human beings do some grooming. And all human beings have some duties to do, especially to do with self-care. On the other side, activities, what we call instrumental, are other than self-care, what tells you do to earn a living. For example, you could be a teacher, you could be a nurse like Sister Malavu here, you could be a presenter like Kerry, you could be a pastor, and
Like Kerry
etc, etc, like Kerry again.
Got it.
So technically that's what I do in my daily work. I help people acquire skills that will render them to be independent.
Absolutely excellent. And with us also, you introduced her already, but we'll introduce her again, Faith Malavu, who is a nurse practitioner. Please tell us a little bit about what nurse practitioners do.
Okay, a nurse practitioner is ideally a nurse who has gone through nursing school and has been licensed to practice as a nurse. So that's what a nurse practitioner is.
Okay, and that's what you do.
Yes, that's what I do.
Super excited. You love it?
Oh, I love it passionately.
Okay, just because you said that, when did you start? We know his story. You're our guest. So just tell us about how you are like, I'll do nursing.
Well, I joined nursing after finishing school. That's nursing school. I qualified, went to midwifery, and then after that, I furthered on in critical care.
Wow.
And I've worked as a critical care for most of my life until I went into nursing administration, and then found this gap where we are discharging patients from hospital and we are not providing them the support they need at home. And that's how come I ventured into the home nursing area.
And that's why we're having this conversation.
Correct.
Sometimes you have a patient who will come.
You know, The first time I met Sister Malavu was, I think, 2006.
Yes.
I was a student intern.
Wow.
And she was the head of nursing in Nairobi Hospital.
Wow.
Yeah, so...
But she looks 20 years younger.
I know. That's what I just asked her. What is it that she's
What's
eating?
the secret? She'll tell us as we continue with the show. Let's talk about what home-based healthcare is and how does one qualify to receive home care services. I'll start with you. And then, of course, you're welcome to chip in, sir.
Well, I think the term explains itself. Home health or home nursing is nursing care being offered outside a hospital premise. Yes.
And so who qualifies?
Who qualifies? Any
To
person-
receive.
To receive. When you're a patient and not able to carry out your day-to-day activities, or you require to specialized care, special medication, or special procedures to be done on you, and you're not able to do it, then you qualify to receive home nursing. Yeah.
Oh, absolutely. What would you classify as impairment?
Impairment can be classified technically into 3 areas, which ideally is what leads us to why you should require a home-based care service. We have what we call cognitive impairment. This is the mental faculties when they are not functioning well, or what we can call a mental health sort of a situation. So that could be an impairment. We have what we call social impairment. Social impairment is when you cannot interact socially. You can imagine if me and you, we are talking and I am crying or I'm screaming or I won't stand all the lights in this room and etc, etc. Then we have what we call physical impairment, which is what many people see because every other time you are walking and you see someone who is walking, you know, with a crutch, then you easily turn and say, what's the matter?
Yeah.
On the other side, you can see people who are on wheelchair. Yeah, so that's technically what an impairment is, an inability to perform duty to, you know, conclusion. So as I've just mentioned, they can either lie either of those two. The physical one is very easy to see, but the cognitive one and the social one are easily not visible.
Absolutely.
When I talk of the social one, for example, I take people who live within the spectrum.
Yes.
Yeah, especially children who won't play. They want...
Is this the autism?
Yes,
Yes.
within the
Okay.
autism spectrum
Yes.
disorder. Yeah,
Wow.
yeah.
You know, you notice the gap. So what ideally should happen when a relative, a friend, a partner is being discharged in hospital? What kind of information should be given to the patient and to the caregiver?
Okay, when a medical practitioner identifies that a patient is ready for discharge, then an assessment should be made to see whether the care being provided at home can be continued at home. So
The care
that-
being given at hospital can be continued at home.
Yes, so that there's continuation of medical care. So that is now what either the sister in the ward or whoever is responsible for the discharge process identifies whether whatever we are doing in hospital, can it be continued at home? And when you find there is a gap, then you try and fill in that gap.
With a specialist or with information?
With both.
With both?
Yes.
Okay.
For example, you may be discharged and you require, say, a feeding tube. and you can be taught how to use a tube, or if you are not able to give yourself the food, then somebody can be taught to do it. And if that's not possible, then that's when a nurse may be allocated to you until such a time.
Absolutely. And that's so important. I can imagine people who just come home and you had one sick day, you found out you were sicker than usual. You get home, you need to give yourself medicine. You're not even 100%. Probably you're stable enough to go home. What happens in such cases? Have you experienced that?
Yeah, lots of times.
What's the intervention for that?
I think good assessment on the people who are discharging you so that they identify that, so that we are not having unnecessary readmissions into hospital or deteriorations because that gap was not identified.
Absolutely.
Yeah.
Duncan, I'm just wondering, who is this team? Is there a home care-based team in your years of doing this?
Yes. The team, of course, it should be multidisciplinary. For example, you can have still the doctor who was taking care of the patient still in charge, or you can still have the nurse who discharged the patient still in charge of the team. You can also have a physiotherapist. You can also have an occupational therapist. Nutritionists are so important in this team because feeding is a process that cannot be avoided. You can also have other members like psychologists who indeed take care of the mental health, not only for the patient, but also for the family. Because remember, we are transferring a patient from a hospital setup, and here we are coming home. So ideally, once we get home, there are some very, very important things that has to be done. For example, we would have a nursing bed. Where will the nursing bed, be positioned?
Yes.
Should we then, assuming, for example, it's a son who is in the father's house, we have to get the consent of the father. Now, one of the
that's very social.
Yes. One of the things I've realized is how we construct our houses leaves a lot to be desired. We build our houses as if we would always remain 16 years. Doors which are, would not even allow a wheelchair to go in or a stretcher to go in, or in an eventuality there is an evacuation that needs to be done from the house out, then you have to call some 5 strong men to help the patient out. So ideally, that's how the team looks like. Not unless I have forgotten.
No, I think it's comprehensive.
It's comprehensive.
Yeah.
Okay.
Yeah.
As we cover that, just go back to that. People are building this season. People have realized, life is short. Let's make the best out of it. Tell them they need to be considerate as they build. Homes and even institutions. There's still institutions that don't have ramps. That's shocking.
It's been happening. I came to practice at a time when we had a president who was sworn to power when seated on a wheelchair. And at that particular time is when really things, started making some level of sense, because anybody can sit on that wheelchair, Ideally, when Kibaki was being sworn in power, there was a nurse behind him, and there was a physiotherapist who was just standing there, and there was an occupational therapist who was standing a little bit a distance from where he was being sworn. So ideally, we need to build institutions that they are inclusive and everyone can go in, whether you are on a wheelchair or you are blind or you probably, won't hear, for whatever reasons. So we still have some few miles to go as a nation, but since 2004, when the Disability Act was drafted and signed, we have made some few moves
Milestone.
here and there.
Awesome. I love it. The conversation today is on home healthcare management. And speaking is Duncan Chengo, who is an occupational therapist. I'm coming back to you to tell us what's the difference between activity limitation and participation restriction. But right now, let me ask our nurse practitioner, Faith Malavu, what do you look for in a caregiver?
Interesting. Any of us is capable of being a care provider.
Oh,
Yes.
you just have to be caring.
Yes, you have to be caring. Sometimes you find yourself there, whether it is your child or your mother, your father, or even maybe your husband. You find them in that state where they are not feeling well, and you take up the role of a caregiver. Yes. So, yes, other than now the medical practitioners.
Let's talk about that. What certification do I need? You know, someone comes and we're going to be paying them some huge bucks to take care of the person. For example, if I'm not doing it and we're hiring a specialist, that's all the things I should ask or I could look at.
Okay.
Except hygiene, of course. If you don't smell good, get out of my house.
That depends on the level of care that you require.
Okay.
The level of care can be very basic. For example, like you may have maybe your parents who are beginning to show signs of dementia. So you may require a minder. You don't require lots of certification. You just require to have a bit of common sense.
Yes.
And to, of course, have caring attitude. So that's the almost very basic. And it can go now to the very complex, like if you have patients who require instrumentation and heavy instrumentation. Say like somebody has to live with a tracheostomy.
In English?
That means a tube, a hole is created
In their trachea.
yes, to help you with breathing or removal of the body's sputum. So that process of removing the sputum will require somebody who technically knows how to do it. So that will require a nurse to do that.
So am I the one to do the interview, or is it the hospital that recommends, or how do you do this?
The hospital should be able to
Recommend.
Yeah.
Okay. And I go with their recommendation, I tell them no, next.
It depends on why you have declined the person they have
Okay. So it's a
recommended.
whole process.
Yes, it's a process.
Okay, that's interesting. You know, I honestly, by the grace of God, have not had to do that. But when that time comes, we'll have a serious interview on a scale of 1 to 10.
Yes.
What if I was fighting with them? What would you do? You know those questions in an interview. So tell us the difference between activity limitation and participation restriction.
When you talk of a limitation, it has a medical background in it. For example, you won't walk because your leg has been amputated above the knee. So when you put that in consideration, then you ask, legs are for walking. So when you don't have a leg, you have been limited to participate in a certain specific activity. And then the activity itself is walking. So the two of them have to work together because the leg is for walking. So when you can't walk, then you need to go and find a reason why won't you walk. Perhaps your legs are paralyzed and you have what we call power. You know, muscles have power. Your muscles are weak and you won't stand. Or perhaps it's your back that is too weak and you won't stand. So that is ideally what we look at as an activity limitation. And the activity itself is what is meant to be done by the specific part of the body. Yeah.
So participation restriction is as a result of
as a result of an impairment.
Of an impairment.
Yeah.
Okay. So that's how that works. How do we help people with disability perform activities? What are some of the things you've had to do over the past?
That's where the team comes in. That's where the physiotherapist, the occupational therapist comes in trying to help with the repair. However, in the absence of that, that's where the care provider comes in helping now take over what the patient was previously not able to do. For example, if you've lost your power on your right side and that was your dominant and that's what you are used to eating before you can learn how to use your left, then the care provider comes in and helps you with feeding. If your, say, right-sided is paralyzed, then dressing becomes more difficult than it was. And that's where the care provider comes in taking over those roles which now are impaired. Yeah.
What if, like, for a child, I watched a friend of mine whose baby came prematurely and she needed an eye patch on one eye to train the other eye. I feel like that's still a huge part of caregiving.
Yes.
And that's something the child can't do on their own. In fact, they feel uncomfortable, they try to remove it, and they have to keep it there for at least an hour until this eye is trained to be stronger, you know, that kind of a thing. So I'm thinking about so many scenarios that I've actually seen caregiving.
And that's why we say that caregiving can be provided by anyone who finds themselves thrown there.
Wow.
Yes, like in this case, the mother was the care provider.
Absolutely.
Yeah.
Tell us, do you have any examples of giving care or you've seen examples, and how have you supported the same? Please text us on 22232 as you also ask any questions you might have as we continue having this conversation on home health care management, and it's very important, and I hear it's getting better and better and better. So you can come in also on this. How do we help people with disability perform activities?
There are quite a number of ways you can help them perform. On top of the mind that you need to have, the independence of these people is very, very important.
At the end, that's a goal.
That's the goal.
Okay.
Such that even when you are not there, they can still live their life. Technology is one of the things. For example, I'm assuming that I live on a wheelchair, and this glass, there's a glass on a table and I need to take water. There is something we call like a reacher that helps grab and then bring it close. There are other things that we can use, for example, like automated wheelchairs. Then there are many, many other examples like hearing aids for those who don't hear, and etc, etc. On the other side is what we call environment modifications. And this one is it's a very big area of disability management, because when the environment is friendly, then they will live independently. Let's take an example of someone who lives with dementia. So you need to declutter the house in a way that if they go in straight to the wardrobe, they will get clothes for the day. And then you have put them in a manner that makes sense. The pant, the bra, the trousers, the tie, etc, etc.
Wow.
And then you arrange them and you label them with big words, such that when they see, they won't keep on concentrating to try and remember.
Figure it out, yeah.
And sometimes you can even use pictures to demonstrate. For example, if you put on a man with a tie, definitely they will know a tie is for fixing on the neck and etc, etc. The other activity modifications is like creating ramps such that they can access the way, having smooth pathways for those who don't have vision. And when you go to the kitchen, for example, if someone lives on a wheelchair, the cooking place is at a level where they can access and then cook. The dining table is low enough such that they can go in and eat from the dining table and clear the table and take it back. And then on the other side, helping, you can also look for a minder. This is someone who will be there in case they need help. emergency evacuation aids can be very important. For example, did you fall from a wheelchair and you need some help? So what should you do? Do you have, sort of a bell on your neck? Or
an emergency thing on your watch,
how to call, or where is your phone at that particular time.
Oh, no.
So there are many ways you can play around with the environment to help the people who have disabilities to manage their lives.
Absolutely. I'm sure you have many questions, and when we're back, we're going to be answering all of them. We need to take a short commercial break, pay some bills. My name is Kerry Kagiri. I'm hanging out with occupational therapist. You know him, Duncan Chengo. He is our resident occupational therapist, and we love him so much. He always comes through. And coming in for the first time, and she'll be back for many other times, is Faith Malavu, who's a nurse practitioner. Thank you so much for joining us. We'll be back shortly.
Our Christian life is not just about God always stepping in when you are in trouble. But sometimes you need to go through the valley of the shadow of death, and God will say, angels, stand away. He must go through that. She must go through that. Because out of this would come something greater and more beautiful.
Only God can turn a mess into a message.
I have a boy on a wheelchair.
Every weekday as he takes us on a journey through the Bible.
Whoever shall.
Welcome to Activate.
It's a good morning. Good morning.
Kickstart your day with George and Kerry on the Sweet Hour of Prayer.
And welcome to Activate, this being the station where you listen and live Hope FM.
From Nairobi to the world.
Great music just for you.
Activate.
The only show that keeps you activated.
Yes, indeed.
Activate. Every weekday morning from 5 a.m. to 9 a.m. Only on Hope FM, where you listen and live.
On Health Check, it's on Hope TV, where you look and live. Really glad to have you watching. At this time, we'll be talking about home-based healthcare. This is home healthcare management. How do we manage our relatives, our loved ones, our partners once they come from hospital and they need our support? They need our professional support. How do we coordinate all this? And we were having a really good conversation with our guests in studio. I will allow them to introduce themselves. Start with the ladies first.
Faith Malavu, nurse practitioner.
Thank you so much for joining us.
Duncan Chengo, occupational therapist.
The joke is that Faith was head of the nurses when he was doing his first year.
Was it first year?
Intern, actually.
Intern.
Yes.
So fourth year.
Yeah. Yeah.
So that's the irony.
Yeah.
But we thank God, black don't crack. As I say, black don't crack, let me thank Zena Glam for the face beat. And the hair is by Lamore. Thank you so much for doing it. Slick by Lucy. Braided me this knotless braid today, and I'm not in pain. So good job, and I'm feeling so relaxed. You know, when you do braids, it's like,
Yes.
I know.
no, these are knotless. So find out what that is by checking out Lamore Beauty Arts. And let's get the conversation. Oh, wait, this dress. Thank you so much, Muli, the brand, for getting this. Okay, so we have a question right here, and it's quite interesting. One is asking, hi, Kagiri, please ask how to deal with a grumpy patient who seems not to appreciate the care from loved ones. Plus, what happens when we get burnout and our loved ones still needs help?
Wow.
So you can pick apart. Let me start with you, Faith. How do you deal with a grumpy patient?
You really have to understand they are sick, number one. And they're not grumpy because they want to. And visualize yourself. Probably if you're in their position, you'd also be grumpy. And none of us chooses to be sick. So when you have that empathetic heart, then you put yourself behind and focus on the patient. And your positivity will influence this person to be more positive. Yeah.
You know, today morning we had a guest in studio on Stories of Hope, and she spoke about how when her mom was sick and dying, those days because of HIV, she used to care for her, and she used to pinch her and even bite her.
Oh, no, that is cruel.
That's
No, when you reach that point, you need help.
Okay.
You need help. And burnout is a real issue. So that's where care providers come in. Whether it's, if it's your mother, you take shifts between your sister and your brother or whoever else, your cousins. But when you have to have the whole burden of taking care, you reach a point of burnout. Yeah, so you've got to recognize it and ask for help in good time. Yeah.
Please comment on this one. I saw your reaction.
I have been in that journey.
You've been bitten, hung.
Yes.
Okay.
And I founded a group. It's a WhatsApp group.
Okay.
I think now it has close to 200 people.
Wow.
We call it Caregivers. And what I do is if I see for whatever reasons you are struggling, then I put you in that group, in that particular group, so you get moral support. And there are people who have walked through the same journey in those groups. So that helps you to try, and catch up with the situation. Now the situation, goes, then, if you find someone who has been in that road, it becomes easy for you to listen. Now, when you were talking, we talked about a multidisciplinary team here. So at this particular point is where you need the psychologist and a psychiatrist to be on a dial. Because sometimes these people don't refuse care, or they don't behave the way they do because they want to. They are sick, and mental health is reality. It's real. There is very little you can do, other than supporting those people at that particular time to get out of that situation where they are. They get an insight, and then, they do things a little bit different. So from my journey practicing, the groups have helped me big time. And I would ask as caregivers to seek help if you find yourself into such situation.
Absolutely. And seek all the support you can. Keep sending your questions on 22232. I will continue with them. Our call lines are officially open. I have paid, with the help of my producer, consultation for our guests. So you have free consultation. Call. Ask all those questions that you need to ask, because they are here, and we can do that as we talk about this. And I think we had highlighted some of this, but I want us to go back there just a little bit. What are the various services that home care services provide?
Home care service is a multidisciplinary discipline. From the doctor, who will be the referring doctor, And then the other care providers, if you look at the nurse, the occupational therapist, the physiotherapist, speech therapy, if there is one, then the psychologist, all those come in and are very, very useful in their different roles.
Okay, and other than that, like, so in their different roles, they use their different tools to, when you go over, you carry your whole kit?
Well, there are different ways this can happen. For example, a family can purchase some of the things that are required, or if there are things that I can carry in my car and come and sort the patient out, then I will exactly do that. COVID changed our lives completely because before, people never used to be, worry so much about home care. But this time around, if you have COVID and you are home, and for whatever reasons you have had some difficulties in breathing, and there's that kikohozi inside there, that sputum definitely have to be removed. So at this particular time, the physiotherapist will come, of course, assuming that you have a simple stethoscope, and then, you have a simple a bed where the patient can lie, and then through postural drainage and here and there, you can always find a way. So equipment vary based on the need of the patient. For example, it's a patient who, like Sister Malavu just talked about, who has a tracheostomy. Then you need to have suctioning pipes, because you have to go through the tube and then collect the sputum from the lungs and then pull them out. You need suctioning machines. Again, you need some oxygen, to try and ventilate the patient. So there are different equipment that you may need. Some of them may need to be positioned there, others you would carry. So at this particular point, every member of the multidisciplinary team will play his own role and will ask for the tools of trade which are required to perform the procedures. Yeah.
Absolutely awesome. As we have this conversation on home-based, not home-based, but home. Why do I keep saying home-based? Because of everything that's been announced by COVID, home-based, it's become a thing. And I was actually at a debrief by NMS yesterday, and so that conversation kept coming up as well. So it's home health care management. And as we talk about this question came up in my mind. It's not obvious to everybody, what do nursing services entail? Because I might have expectation from a nurse and she's like, that's not my job. Call her, call this one, call that one.
Yes, nursing is very wide.
It is.
In fact, it's said to be the center of all these other care providers.
Okay.
So we are able to play a small role here, nutrition here, some physio here, some medical here, some pharmacy here. So it's very comprehensive. So it's the core of medical care.
Okay.
Yeah.
So like in a home, when I get a nurse, ideally, I know there are different situations and all that. What are the expectations?
You expect this nurse to be able to help with the patient with the activities of daily living that we alluded to. You expect them to assist the patient with hygiene, their own body hygiene, hygiene of the environment, advise you with...
nurses are so clean.
Yes. Infection control is the core of nursing care.
Infection control.
Yes. We prevent cross-infection and even internal infection.
So every restaurant should have a nurse?
Not necessarily. That's why the healthcare workers to advise on that. Yeah. So the nurse should be able to advise you on all the care that you need, and where they feel that it's beyond their scope, then reach out to whoever's area of competence that is.
So Mr. Chengo comes and helps train me kidogo to not relieve the nurse, but to be able to do this thing. Does a nurse train on how to do it, or they do it for you, then he comes to train you on how to do it?
No, he comes to help the patient be able to recover in that particular area. For example, if it is teaching the patient how to feed using their left hand as opposed to the right hand, which now is paralyzed.
Meanwhile, when he's not there, the nurse is feeding me.
Yes, the nurse can feed the patient.
Okay.
Yeah.
Got that. How about these things we see as obvious, like going to the toilet?
Yes.
Yeah, like if you have a nurse, do you have to wear like diapers? I don't know. I'm just trying to figure it out.
Not necessarily.
So they support you too.
Yes.
I think it's a determining factor is the level of care that is required.
Sometimes
you can have,
or disability.
You can have patients who are completely bedridden, and then you have to use diapers, to make them clean. You can have people who will tell you, could you walk me please to the toilet? And then they go to the toilet. Perhaps you help them do cleanup after the toilet. Sometimes you can have it doesn't have to go to the toilet completely, but there are some modification that you can offer bedside. For example, what you call a toileting commode. That's it. You just push, lift the patient on the toileting commode.
Then you go throw it out.
Then you come, pull it down, and then you go and empty it. Yeah, so it's about the level of care.
Okay.
Yeah.
I'm just trying to understand for the sake of our viewers. Remember, you can ask any questions you might have on 22232. You can comment on Facebook and keep sharing this video. Everybody needs to know and learn about this. How do you take care of bed sores?
Wow.
In the first
And what
place.
are bed sores? Someone doesn't know. Me, I know.
Okay, what do you think?
I think bed sores are like when you've been in bed for so long, umeganda, like, no?
Okay.
Go
It's
ahead.
actually called a sore when the skin has broken.
So the
but
skin
before
has
we
to be-
get there,
Okay.
let's avoid them.
Let's avoid bed
Yes,
sores.
let's avoid bed sores.
Okay.
And very, very simple. Turning the patient and offering what we call pressure area care. Massaging the pressure points. Say if it is the back of the head, the shoulders, the gluteal areas, the heels. So you just increase the circulation to those areas. So if you do that and you turn the patient, then you will not have the pressure sores. However, it's good to look at this patient that we have in context. Assuming again, you have a right-sided paralysis. So this side doesn't even feel. So you may be lying on that side, it may be beginning to have a sore, and you don't feel it because your nerves on that side are weakened. So therefore, the need then to turn you from side to side, make sure you're not lying too much on that side for prolonged periods, and then when you're turned, increasing the blood circulation by doing the pressure area care. That's how to avoid the pressure sores.
Wow.
Yes.
Okay.
Yes. So
Yeah,
in fact, we look at pressure sores as a sign of neglect. Yeah.
It is.
Yeah, we don't want to get there.
No. So let's not get there. Let's turn our patients. Let's look at them. So wait, so when the sore is there, there's a crack in the skin.
Yes, there's
Wow.
a breakage in the skin.
That's so bad.
Yeah.
Okay. And where were you if you didn't notice this really? I get that. So no one is cleaning the person to notice.
Especially if they are soiled.
Yeah.
You don't clean them, then that becomes a very good media for skin to break.
Yes.
Especially if there is stool and urine,
Yeah.
then generally this area is going to break down.
Oh no.
Yeah.
Okay.
So if they go to the washroom or have past stool or urine, that should be cleaned promptly.
How? Okay, I was going to ask how
Promptly.
often. You have answered.
Promptly. Yeah.
You have answered. Absolutely. You have a comment on the same. No. I saw you jump like no one should have any sores.
Yeah,
Say no to bed sores.
Yes,
Say no to bed sores by all means.
Precisely.
Yeah.
Give us placards.
we go on the road.
We need to go on the road like there's some guys I see advertising some shop. I won't advertise here.
Yeah.
Anyway, as you talk about that, what is expected in rehabilitation services? And what is rehabilitation services?
To rehabilitate is to, try and take the person to former self. So that word becomes very ambiguous because it comes a time when you cannot really go back to your former self. But what we do, we make sure that you are as functional as possible. So ideally, what it takes is it's a good team, again, the multidisciplinary team. So you could have, again, the physio, the occupational therapist, the speech therapist. Sometimes you could have prosthetist orthotist.
In English?
Miguu bandia. if you amputate it.
Oh, yes,
And
got it.
sometimes you can have some splints. These splints are orthotics that are used to to support a specific part of the body. So ideally, the rehabilitation team needs to work together based on what needs are. The psychologists, they are also part of the rehabilitation team as well, and sometimes you can have the audiologist in there.
This psychologist is both for the family and the person, right?
For the family and for the person. So it's a team. So the goal of rehabilitation is to make you functional.
You said audiotherapist.
Audiologist.
Audiologist. What is that?
These are there are people who take care of your hearing.
So they're like ENTs.
Not really per se.
Audiologist.
Audiologists, it's about investigating whether your sense of hearing is there.
Okay.
Yeah.
I could just clap. Can you hear that?
Yes, I did.
I'm an audiologist.
Yeah.
Okay, no, I'm sorry if you're an audiologist out there.
Yeah.
Okay, I see you. This is a very case-specific question, but how often should a patient be attended by a physiotherapist, an occupational therapist, or a speech therapist?
Wow.
It's very case-specific.
It's very specific.
Yes.
So the frequency is subjective assessment advised by clinical reasoning. So when you were just seated before you joined us, I was telling her the pain of seeing for sure, for example, especially in pediatrics, this baby requires to be attended on a daily basis, or at least 4 times in a day. And perhaps it's a single mother, and this mother has to go to work every day, and where there is no home care or home-based services, the patient has to be, the small baby has to be transported to the clinic. And then what happens at the end of the day is, if the mother won't manage every day, because that is what is required, you end up having mother having one session. And this really drowns me completely. It takes my energy away. Because you get to a level whereby you are working, but you can't see the results that you are working for. So it's not that good. But that's what drove me to do what I do. So what I did, I set up clinics in different suburbs of the city. For example, if you're in Kitengela, you just need to ask for service and getting right in Kitengela. And the person who is based there doesn't have to walk all the way back to town and etc. So ideally, the frequency is advised by the needs and the demands. Sometimes you can have where professionals overlap one another. Or, for example, if you have a problem with memory and they do which falls under what you call cognitive therapy.
Yes.
And then the speech therapist has to come and try and facilitate the oral articulation issues and etc. So they are likely probably overlap one another. And if they all overlap one another, then at this point where you realize rehabilitation can be a full day job. For example, you wake up in the morning, have your physio. At noon, have your occupational therapy. I'm assuming is a stroke patient who got a right-sided stroke.
Yes.
So you have to teach him how to write with your left hand. And then after that, the patient has some cognitive issues. After that, goes for a cognitive therapy session. And then after that, there are some psychiatric issues that need to be addressed. The psychologist there.
This is a school. I'm hearing math, chemistry, PE,
ideally.
physics.
Yes.
Yeah. Sometimes there are some procedures that will require what we call intensive therapy programs, whereby it's a whole day of activity. Sometimes you have hydrotherapy, they have to go to water. So it can be... So the frequency is very tricky here. It's purely a subjective assessment.
Absolutely.
Yeah.
We're talking about home, I have to read it so that I say it correctly. Home health care. That's what we're talking about. And we would love you to ask any questions you might have on the same. I'm coming back to you, Chengo. I was almost saying doctor. We're always tempted to call you doctor.
Okay.
One is saying, please help on how my dad can gain speech after having a stroke. It's going to 3 years now. Please help. I'm coming back to you as you respond to that. But I want to ask Faith, what is the most specialized care that you give, most common conditions that you attend to?
Most common causes, I would say, are post-stroke. Yes, post-stroke are the most
Yeah.
common.
So you can comment on this one. On the person texting in, you can just make your comment. They're saying, help. How can my dad regain speech after having stroke? It's going to 3 years now. Please help.
They need to consult with a speech therapist. But before then, I don't know what their neurologist would say and whether there is any possible recovery. So wouldn't want to give hope if there's no hope. So their neurologist will be able to tell them
If there are signals being sent to the
Yes.
nerves for speech. And
Yes.
also speech, yeah?
and even what they are able to speak.
Yes.
After that, then we consult with a speech therapist. Yeah.
Absolutely. Can you add anything on this?
It happens based on the severity of a head injury or a stroke. Sometimes you can regain your speech. Other times you can regain your speech with challenges. Speech is a very wide area.
Yes.
So sometimes you could be hearing what I'm telling you, but you have a problem of understanding.
Cognitive.
Other
Is that
times,
cognitive?
yes, you understand, but you cannot verbalize. So ideally what you require is a detailed assessment based on where the patient is, because occupational therapists and speech therapists, many times they may not be, relatively available, especially where in rural areas. So you look for one, have a very detailed assessment, whether it's a cognitive issue, require cognitive therapy. If it's a speech, really speech issue that require, at some point you may want to use the two, the cognitive therapy, the speech therapy. The neurologist here will, as Sister Malavu has just said, has to be really part of the team, because it is through him where, we'll get the guide. When all is said and done, if the verbalization is not there, then teaching optional communication skills is very, very important.
All right.
Allow him to, and that's, again, I talked about home modification, environment modification. Would you have him use for example, an iPad? If he wants to communicate, he will type. Would you have a biro, and then if at all he can write? If the right side is affected, because stroke that has speech challenge many times is the left-handed stroke.
Okay.
So what worsens the situation is when you cannot train the left hand how to assume the functions of the right hand, what we call dominant hand transfer therapy training becomes even more difficult. So I would advise this particular client, see an occupational therapist, see a physiotherapist, and then from there you get sort of an assessment. If there are some few things that you want, they can be put within your reach. For example, if you lift water or you point water, you need food. If it's food, from food chart, you can go to types of food. You need broccoli, you need ugali, then keep on pointing and pointing. There are options of communication that can be done.
Many, yeah.
Really. Letting this or taking these patients who have speech challenge through a psychological support system is very important, because it helps them settle down and perhaps know that you may never ever talk again the way you used to. So you have to learn again. You can imagine teaching an 80-year-old man how to write with the left hand.
Yeah.
So
That's why then in nursery school they should teach us to be bidextrous. So everyone can use both.
Well,
Then when time comes, is that?
Well, hand
An
dominance is a very serious brain thing. So not all people who can acquire.
Are you?
Yes, me I do, because I train them every day. So I can use my two hands to write or to do everything.
So cool.
Because that's what I do every day anyway.
Okay.
Yeah.
Can I come help you so that helps a lot?
Karibu.
Yeah, okay.
Yeah.
As we talk about this, I'm just really curious. This is also very case specific. Equipments that should be added at home for patients' welfare.
Wow.
What are some of the maybe basic?
Yeah, very specific. However, there are some basic. It's almost important now to have a blood pressure machine.
Yes.
Yes.
Very important.
Now in this period of COVID, the SpO2.
Yes.
Those are now almost very common.
SpO2 is the
for saturation.
oximeter.
Oximeter, yes, precisely.
I had to use my toe for the oximeter.
Your door?
My toe. Because I had like gel nail polish and I was in quarantine and had an oximeter and it couldn't read my...
Okay.
Yeah, because...
that's
so
fine.
I put my toe, is that...
Yes, in order, yes. So if you're diabetic, then it's important that you have a glucometer.
Yes.
So those would be the basic ones.
Okay.
Yeah, blood pressure machine, oximeter, and blood sugar machine if you are diabetic.
Absolutely. And if you can afford it, have it now. Don't wait for that last minute to kind of grab that. Okay. Any other you could think about? And you had talked about opening up your doors. Let's stop building, not in any personal way, Chinese doors. They're about 73 inches. You can't even fit your couch. So, standard doors should be 80, but maybe you could go bigger.
But the most, what I've seen from my experience is a BP machine.
Yes.
Blood pressure. Every single home from where I'm seated
should have one.
Should have a BP machine.
Okay. You
that one for and then.
And what is a standard BP? There's someone I was doing for, and I didn't even know there is like 123/81. I don't even know if that's good
it's
or
like
bad.
Temperature. These days, all the security men in every
36.5.
No, they are all subnormal.
They all know.
All below 35, and this is no more temperature. Even when it shows 33, they show you and you are allowed in.
What?
They said, oh goodness, we are in an age where the askaris are the ones who monitor your temperatures.
But temperature is not a measure. I'm sorry to say this, but I had COVID and my temperature stayed normal. It used to be irregular at night only.
Especially with this third wave.
Absolutely. So may God help us all.
No, I think that one we need to relook at whether temperature we should be having, even there at your door, the temperature monitor.
Ours works.
So thermometer is another one. Very important, especially when you have children.
Yes, very
it's very, very important.
Okay.
I've through my practice, the damages I've seen fever do, it's too bad. So just have one. And every other time you realize the fever is anything above 36. If you are 38, please get an ambulance and run.
Yes.
Yeah, don't stay with fever. Fever is dangerous. I've seen it cause a lot of mayhem.
So try and get all these things right now. I know you're probably saying these things are expensive. Will I buy food or this? Start saving up. Maybe now you could start whatever it is. Yo kidogo kidogo alafu you get to buy one. Government
and
can give everyone one. Thank you.
First aid kit.
First aid kit.
First aid kit.
With what inside? Now that's the hapo ndio kizungumkuti.
Hapo ndio kizungumkuti. Some for example, a crepe bandage. As simple as it's very important to have it at home, especially when you cut yourself, for arresting bleeding.
Hiyo ni elastoplast. Kuna ile bandage ile.
Kuna ile hiyo sasa
ile unafunga na pin ya napi.
Hiyo sasa hiyo. Yeah. Inaweza kuwa na sling ndani for support. Unajua ile inakanga triangle hivyo alafu unaweka alafu unashikilia. Iko na some few paracetamols and aspirin. Yeah, very, very important.
Aspirin is so important.
Aspirin is very important. You know that?
Yes, I do.
Very important.
I have learned.
Yeah. So etc.
So get it, put all that stuff in there. Is there anything we can add?
No, I think we've talked about basic.
Why is the what? Someone is asking me inside my ear. Why is it important?
Important for?
Aspirin, they don't know.
Aspirin, especially if you're getting a heart attack. Yes.
It's a blood thinner.
Yes.
It's a blood.
So it makes your blood move. It ensures you don't clot. Yes. But someone asked me, they're like, you guys know, we don't know why it's important. So you need your blood to be flowing in your body, because if you get a clot, then that's now another whole conversation. So that's why you need aspirin.
The first thing when you realize, if you suspect someone has suffered stroke, people advise, doctors advise Patiana. It saves heart attack.
Helping members of the family take care of their loved ones. This is difficult. Everyone is busy. We love you, but we need to make ends meet. So can you just cooperate and...
Yes, we when you find yourself in a situation where one of your family members needs extra help, then you need to embrace it and adjust your life accordingly, so that whether it is your husband or your sister or whoever, then you now must accommodate this into your new lifestyle, so that none of you is ever too busy for this person. Remember, none of us has to be sick, and any of us can be sick. So adjust your life to accommodate this person who now needs help, and take it as your priority. Yeah.
We had highlighted dealing with feeding challenges. I can see the question come back again, but I'll ask this one. Hey, Carrie, how often can we do physiotherapy for my dad who suffered a stroke 2 years ago? Are there any short courses on physiotherapy like there are for first aid? That is Sami in Mulolongo.
The answer is no. There are no it's a highly specialized profession.
Yes,
get ready to be prepared to go to school for 4 years, sometimes 5 years. You have to. However, there are some few very basic things that you should know. For example, how to crutch walk, which is like common sense.
What is crutch walking?
Crutch walking is using kijiti kutembea.
Okay.
I tell my students first, good leg goes to heaven, bad leg goes to hell. It's a simple way of cramming it. You remember those things that we used to cram in?
Yeah.
Yeah. So when you are crutch...
Is it an acronym?
It's an acronym.
So G...
When you say good leg goes to heaven, it means that you are going up the stairs.
Okay.
So the good leg should always go up the stairs first. When you are going down the stairs, then bad legs goes to
hell.
And hell is...
down.
So you find a way how it's an acronym of how to deal with this. They are very simple basic things.
Okay.
How to transfer a patient from bed to wheelchair. There are simple things that you can learn. Again, the question of how often is where he is now. Has he managed to walk?
Has he managed to walk, Sammy?
Number 2, if he has walked, can the hand grab something? Because it comes a time when you separate stroke rehabilitation to hand rehab, such that you need to concentrate purely on the hands for functional reasons.
Okay.
And then you separate mobility to have its own path. Yeah.
And then is there like homework you give? Like if I could only afford to come once a week, then you send me home with the thing.
Yeah, we have what we call home assignments. Which is something that I'll give you to go home and try and do. Sometimes I could give you a ball, I leave you behind to squeeze. Sometimes I give you some what we call active exercises. An active exercise is what you can do yourself with an instruction. For example, lift your leg 20 times, take your legs aside 2 times, bend your knee, hold it close, breathe in, breathe out. There are things that can always be left behind for the patients to do.
Absolutely. Yeah. The conversation, if you just joined us, you've missed a lot of great action, but it is available on Facebook and YouTube. So make sure you catch up. It's on home health care. I'm hanging out with Duncan Chengo, who's an occupational therapist, and Faith Malavu, who is a nurse practitioner expert. I know she looks young, but she has done this work, and she's really good at what she does as well. So thank you so much for all your questions coming in. Keep them coming. I'm going to continue asking them just 2 minutes. But is there anything we haven't highlighted on feeding challenges?
Yes, feeding challenges, they can be very, very tricky. Number 1, we have optional feeding challenges that can be advised by the clinical team. You can have an option of what we call PEG. PEG feeding is a tube which is inserted on the tummy and it produces, then you
do that?
Yes.
Yeah, and those are some of the things that Sister Faith was saying. They are too technical to be left under the hands of an technical team. Okay. Other times you can have a tube that goes through the nose, it's called an NG, then goes inside the tummy. Now, it comes a time when the process of withdrawing this or this to introduce oral swallowing process requires an occupational therapist or a speech therapist to help you that journey.
At this point, does someone have maybe dysphagia because they're not used to?
Oh, you know dysphagia?
Yeah.
Wow.
This is health check. Welcome to health
Wow.
check. We can just highlight that because now I can see where that could happen. Maybe due to lack of activity, then it's
Yeah,
collapses
sometimes it can collapse. Sometimes because of the tone, a tone of a muscle can contribute. There's that tension that you require to perform. Sometimes can be highly compromised for whatever reasons, and especially if you have a tracheostomy, that tube that we just talked about. Feeding can take you back to ICU if you're not very careful. So I always advise patients or caregivers, especially the ones who are not very technical, do not even try.
okay.
Please ask for help because it's a process. You know the way you win a baby, the same way you take that journey.
Okay.
For children who have a condition, and to be very specific, either an hypotonia or an hypertonia,
In English.
whose muscles are very tight
Okay.
or whose muscles are very flimsy. Sometimes you can feed them and then the food misses the GIT system and finds itself into the lungs, and then that can cause damage or can cause pneumonia. So you have also to be very, very careful.
Oh, yeah.
as
The
you-
food. Yeah, if it
how
goes
you-
to the lungs, it's dangerous.
Yeah.
Let's talk about the pipes and everything. How often do you change them?
Depends on which pipes.
Okay, let's talk about
almost
PG.
every opening into your body can be put into.
Even your ear.
Yes. Well, but not necessarily
Okay.
for home health. Yes. So it depends on which tube you're talking about.
Yeah.
If it is a feeding tube like the one he talked about, the nasogastric tube, there is what is supposed to be done. If it is, say, like the breathing tube, that the tracheostomy also has the period that it should be changed. If it is the one that is in the stomach, some people have what is called a colostomy, where you are not able to pass stool the normal way, and therefore an opening is created into your abdomen so that your stool can come through, whether it is a tube for passing urine. So all the different tubes, depending also on the type of material that is used to make them, have their different recommendations on when to change them.
So how can we support
Yes.
home-based care specialists? Because we need to take a break. You need to go, for Sunday. So another one has to come. Or
Yes. It's
there's nothing I can do to support you.
Depending again on what support I'm asking you, I certainly will not ask you to help me, clear the chest with a tracheostomy tube. But maybe the patient is sleeping. I can ask you to keep watch over the patient until the next time they require my help. Yes, that way we can support one another.
Okay.
Yeah.
Absolutely.
Again, of course, depending on how sick the patient is and what level of care.
On that note,
Yes.
there's something called a caregiver's guilt. I don't know. In my practice, that thing is dangerous. Whereby the family, people, or a key member of the family is the caregiver. And then you caregive too much, you forget yourself.
Oh.
And then you begin assuming when you ask for free time to go to church or for free time to go and have your nails done and your hair done, you feel like you've neglected. You just want to be there throughout. Sometimes you may not necessarily be the primary caregiver, but you caregive financially, you caregive social support, the patient is hosted in your house and etc, etc. And it is at this particular time, if you get to that level whereby you begin feeling that you can't even buy anything for yourself, the small money that you have, all of it, you are directing it to, then unaanza kuvaa shati zenye zimeraruka na we ni mtu wa heshima. I've seen it in quite a number of family setups.
That's neglect, self-neglect.
Yeah, it's self-neglect. So always seek for help. Don't get that. And remember that every other time you get there, please ask for help.
Absolutely.
If you ask people who have been through this journey, they will tell you how to cope with it. And sometimes have that good friend because friends could always be there who you can just dial away and tell you, please come and sit for me. I go take care of myself.
Yeah.
Yeah.
Absolutely, I love that. And we have discussed this before. The best care you can give is when you are already cared for. It's very good for you to be emotionally healthy, spiritually healthy, physically healthy, for you to give care to anybody else. That's why nurses are just number one. Like, nurses are always looking fabulous, all put together. It's the truth. All my nurse friends are just on point. They always working out at Karura, you know, and then they can be able to give good care. So take care of yourself first. Even in the aeroplane, let's start there. When you're being given instructions, it's put your mask first, then assist.
Yes.
Because, yeah, you can be able to assist if anything happens to you. So not in a selfish kind of way, but in a good way. Ask God to help you. He's so good. He's so kind. He will help you. We're wrapping up this conversation today. Thank you for all your questions. I'm trying to open up the questions on Facebook. If you could transfer them to 22232, that's fine. I can give you an opportunity still to call. The number is right below the screen. You're welcome to do that as I keep checking out your questions on our pages. As we get there, common challenges you have faced through the years. I'm sure there are things you have seen with your eyes.
Yes.
Yeah, just share some of them.
Yes. I think the most common one is when you don't share a common goal. That is you as a care provider and the family. If there is breakdown in communication, then you find that you're not reading from the same page, and you find that there can be conflict between the care providers and the family. I think that is the most common one. And how to address it is right from the beginning. When you engage, you address what the objectives of the care is, and then keep your communications channels open and keep listening to one another. Listen to what, say, the family is saying. Even the family, listen to what your care provider is saying, and then keep reevaluating where you are and what your next steps are. And then you find that if your channels of communications are open, then there will be less and less miscommunication.
Absolutely.
And you find yourselves achieving the goals, and you celebrate them together.
Yeah, the milestones and everything.
Yes. Another challenge is when family decides to take some non-conventional or
approaches.
Yes, approaches. Yes.
Yes, let's talk about it.
Yes. And unfortunately, we are still in a society which thinks of some of these things have come as a result of uchawi.
That's true.
Yes. So
or Allah has sent this on us. And so.
Yes. So you may find, say, like whether it is a child who is born with some disability, it is because you did X, Y, Z, and therefore they are going to seek all sorts of help. And not to say that alternative medicine is bad, but some of it is really non-conventional. So that can be a conflict with the healthcare providers. How do we address it? You have to respect the family, but also put your case across. And where you see that it is really going to adversely affect the patient, then be the patient's advocate. But if the family is, they feel that very strongly that that's what they would like to do, then you are in their premise. And sometimes it's very difficult to say no.
Wow.
Yeah, so those are some of the challenges.
Who can a nurse report to now? Like, I'm going through this challenge, and these guys are like, the only way to help this one is a change way. And that time the person, probably has a very thin blood, they're on aspirin or something. They want, them to be cut, waekwe madawa huku kwa you know that? Yeah. What do you do? Provide them with sterile knives?
No, if it's to that extent, some of it you just decline and say absolutely no. Yeah, this is dangerous. It's dangerous to the patient. And once you have put your foot down, most of the times they will come and cooperate with you. Yeah, especially when you're able to help them see where you're coming from and what is detrimental to the patient. But yes, it can be quite a challenge.
Yeah. Where's the line between professionalism and African traditional norms?
yeah, that's a thin line. A thin line. But again, experience in the field and wisdom on how to advise them and help them understand that this is really not making any sense. Sometimes it's just a guilt feeling that they want to try everything under the sun. And if it is not harmful, allow them to. But if it's harmful, then certainly make your case.
Absolutely. Speech therapy for non-verbal kid.
What about it?
What about it? What about it? Someone just texted that.
Yeah.
I thought it would be something you would get. But they said speech therapy. Okay, maybe the kid is not speaking.
The most important thing is get to know, because there's no baby who will not speak without an underlying issue.
Yes.
Is it a sensory processing issue? Is it a hearing problem? Or is it an oral structural issue? Either of that could be the thing.
Absolutely.
But just before we get out of that challenges.
And Faith, you'll be preparing your closing remark, your encouragement to all the people who have been doing this kind of support, and you also prepare yours.
People who have intellectual challenges, or you've been fine and then after sickness there is only you're meant you can't think right.
Cognitive.
Yes, and you have family members who are fighting for who should keep you. However, deep down the heart, you have some family members who don't mean good. They want the patient to die quickly in favor of wealth and etc. This is one of the biggest problems that I've experienced. One time, I do a lot of handwriting stuff, whereby someone is paid me millions to train, and I know deep down no matter how much, but I'm being pushed to the corner to give false sort of hope, because someone wants the finger to write so that can be transferred for documents in an illegal way.
Oh no.
So some of these, there are common challenges, and when you move, when I come to your home to offer something, that's not an office.
Yes.
So the home setup is not very conducive for visitors who are coming to do some clinical stuff, So the home setup has got its own challenges. For example, it's a nurse who you have to sometimes sleep next to the bed, and probably, as I told you, because our structural construction issues are it's like a small room. The nurse has to be comfortable with a mattress. I'm sure Sister Malavu has seen all these things. So there are challenges.
Are there not regulations?
There are no regulations. That's where I was coming. And that's one of the biggest issues. Sister Malavu will tell you, especially on the nursing side, whereby the regulator of the nursing staff, there are some gaps somewhere between people who are not necessarily clinically trained nurses and people who will support, for example, make bed. They don't really require that, 4 or 5 years of schooling to do some few things, transferring patient, helping wheel the patient away, and etc. So there are some regulations that need to be made. I tried forming a caregivers association, and unfortunately, I've not registered it for some reason.
Yes, we have a minute and a half, so we're winding up. Yes.
Yeah, so I think that's my punting shot ideally. Government needs to come very clear and put up legal structures to, for control of home health.
Yes.
Because it's a reality now with COVID. The other thing is the institutions, employers, and insurance companies who really pay for these services.
Yeah.
Home care is not a comfort.
It's
no one really,
It's needed.
It's needed.
So does the NHIF pay for this? I'm just asking.
Not at the moment.
Not at the moment. But it's something, I hope, that's been worked on, because we need this.
Yeah, now, these are the regulations that I'm talking about, whereby
they need to be set up in.
Yes, the institution, the insurance, the employers, you need to factor all these things when you are planning for long term.
Thank you.
Welcome.
I give you, to just close because we have 1 minute and we do have Newswatch at the top of the hour and we have Chiriku as well. Great programming lined up for you right here on Hope TV where you look and live. How encourages people.
Yes. Jesus gave the example.
Yes.
And he told us that when he comes to give his kingdom, he will separate the sheep from the goat. Those who have done well will be told, well done, good and faithful servant. When I was hungry, you gave me food to drink. When I was thirsty, you gave me something to drink. When I was in prison, you visited me. When I was sick, you visited me in hospital. And when you did this to the least of this, you did it unto me. So when you provide care to that person, you are actually touching the Christ. So any of us who finds ourselves in that position, you are blessed of the Lord.
Amen. Wow. I want that to be me. Yes. And thank you for all the work you do. Setting up occupational therapy centers, in many spaces, that is a great work. And whatever you're trying to do right now, it will go through. There are great conversations right now. Platforms, people are being more open. So this association will happen. Absolutely. You should put me in the trustee board. Thank you very much. Have a good evening. And I want to thank our guests just one more time. How can guys reach you?
My number is 0726 272223. I'll repeat again, 0726 272223.
Awesome. If you want to get to Faith, call me. I know where you can find her. Thank you so much.
Thank you.
Awesome. Until next time, we'll see. This has been Health Check. Share this video and thank you for watching. Bye.